everyone, so today I'm going to talk about schizophrenia. I'm sure that most people are familiar with the term schizophrenia, but do you really know what schizophrenia really is? So schizophrenia, the term schizophrenia can be split into two, which is schizo, that means split, and phrenia, that means mind. So schizophrenia means the split of mind. But it is not a split personality because that is a different disorder. But instead, schizophrenia is described as a scattered pattern of thinking because it's actually a syndrome in which different patients might experience different symptoms. So talking about symptoms, let's look at the symptoms of schizophrenia. So there are three types of symptoms in schizophrenia, which are the positive symptoms, negative symptoms, and also the disorganized symptoms. So the positive symptoms does not mean that it is helpful, but instead it is more like a psychotic symptoms, for example like delusions and also hallucination. And the second one is the negative symptoms. So negative symptoms is where there is an insufficient in normal behavior, such as anhedonia, asociality, and also alogia. And the last one is the disorganized symptoms. There are two types of disorganized symptoms, which are disorganized speech and also disorganized behavior. So all of these symptoms must be ongoing for at least 6 months before it can be diagnosed as schizophrenia. So you might be wondering what causes schizophrenia, right?
So do you know that the causes of schizophrenia are still unknown? But research suggests that it is a combination of genetic, brain chemistry, and also environmental factors, which can make a person develop this condition, such as having a family history of schizophrenia, pregnancy and birth complication before and during the birth, childhood trauma, structural and chemical changes in the brain, and also previous drug takings. According to the World Health Organization (WHO), there are 20 million people worldwide that are affected with schizophrenia. Besides, the lifetime prevalence rate of schizophrenia is roughly equivalent for men and women. It is also estimated to be 0.2% to 1.5% in general population, which means at some point this disorder affected 1% of the population. Well, you might be wondering, is schizophrenia treatable? The answer is yes. It can be treated with medicine and also psychological treatments. Antipsychotic medications such as risperidone or olanzapine are actually recommended as the initial treatment as it reduces the psychotic symptoms that presents, and it also reduces the potential of the acute episodes and its severity in the future. Last but not least, psychological treatment such as CBT or supportive psychotherapy may reduce the symptoms like hallucination, delusions, and enhance the function. Meanwhile, other treatments are specifically aimed at reducing stress and also improving social skills. So that's all from us. We hope that you enjoy watching this video. Hopefully that this video helps you to understand more about schizophrenia. Thank you.